So I'm midway through my final semester and I'm looking at different options, and NP school's looking really good. Hello, my name is Jeremy. I'm a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and hit the notification bell for future videos we upload on Wednesdays and Sundays, and let's go and get started. So, about to graduate pretty soon. Gonna end up landing a ER or ICU job. Probably have a residency that lasts anywhere from 3 months to a year. But after that year is up, I've been strongly considered NP school, and here's why. Essentially, I've always wanted to become a healthcare provider. Originally, I wanted to be a trauma surgeon, but then I realized that I don't really want to be a surgeon after my rotations. So essentially, after I found out that I didn't want to be a surgeon, I figured let me look into the nurse practitioner or the PA route. PA was essentially like the same requirements as med school, which would have been more time consuming, and NP, it really just slips in, so it's looking like the more enticing option. PA or med school, I would have to do organic chemistry or physics, which adds an additional year to the training. NP, after I'm done with my residency, which would take like a year anyway, or some programs will allow me to go in after a year, some will be 2 years, but essentially all I have to do is just apply and I would get in. Essentially, this would basically save me time and money, and basically I'll get the same results. What I ultimately want to do is I want to be a healthcare provider in an emergency room. I want to be that ER provider that's able to intubate, do chest tubes, that's able to diagnose and prescribe patients and discharge or send them to the ICU. And for what I've noticed, ER nurse practitioners can do this. So with that being said, I had a choice between two nurse practitioners. The FNP, which is the family nurse practitioner, and the acute care gerontology nurse practitioner. So the family nurse practitioner focuses on outpatient care, so that means preventative medicine. So that's like your yearly checkups, that's like your diet, making sure your diet's in line, making sure you're essentially keeping up with your health before it gets to the point where you have to go to the emergency room or anything like that. The acute care goes more into the aspect of ER, ICU, and acute care, which essentially adapts beautifully with the paramedic aspect. So right now, that's seeming like the most enticing thing. The program in particular that I'm looking into is the acute care program at Nova Southeastern University in Florida, like that's in Fort Lauderdale. And the reason why I'm saying this is acute care, and then I could finish that, which is essentially like 2 to 3 years, and then they have an emergency room certificate that will give additional training so it can look more enticing to hospitals. After further research, I would have just strictly did the acute care, but seeing the difference between a nurse practitioner and a PA or medical resident, the training hours is quite different. The PA and med school resident or medical school, they get essentially, I believe, 4,000 clinical hours of training. Nurse practitioner is 500 to 1,000. So my mindset, just so I could be a little bit more prepared, I probably won't be on the same level of them until probably like a year or two working along with them. But with the ER certificate thing, it might bring me up to speed to be a little bit up to speed, so I can basically won't feel like I'm behind in a sense. And I get it, like after a certain amount of years, the PA, the emergency room physician all meet at the same thing, and we're able to essentially do the same thing with some differences between the PA, NP, and the well, I will say like the NP and MD in that case. So with that being said, there are two routes when it comes to the nurse practitioner. There's the master's degree and there's the doctorate degree. The master's degree just focuses mainly on getting you ready for the license exam to work as a nurse practitioner. So you can basically still do essentially the same things along with it. The second option is to basically get your DNP, a doctorate in nurse practitioner. So it pretty much would focus on the research aspect, because at the last 2 years of that program, you're essentially coming out with a thesis, and then after you do that thesis, you're gonna a project where you would pretty much just create a plan that can benefit nursing and healthcare as a whole. So it's pretty interesting. So with all this being said, considering the NP route and stuff, if you was considering the same thing as me, what would you do? Would you do the FNP, or would you do the acute care, or would you just not do it altogether and focus on being a nurse, and which is respectable in itself? Like, comment, and subscribe, and hit the notification bell, and see you in the next video.